So, again, another really good question, because pulmonary fibrosis does cause lung damage and makes the lungs stiffer. And one of the problems that ensues is that as the lungs have less oxygen, the blood vessels in the lungs actually constrict and become much smaller. And this means that as the heart pumps blood through the lungs, it's having to work much harder to get the same volume of blood through these much smaller blood vessels. So the right heart will eventually be under so much pressure that it will start to fail. And at that point, patients will notice a dramatic increase in their shortness of breath, and they may develop swelling of the ankles and particularly more shortness of breath when they are exercising. So this is called pulmonary hypertension. And the way we treat pulmonary hypertension is to use diuretics to get rid of some of the fluid, so the heart isn't having to work quite so hard. We also make sure that the patient is really properly oxygenated, particularly at night when they're asleep, because this again takes some of the pressure off the heart by opening up the blood vessels. That's really probably the biggest complication of pulmonary fibrosis. We also know that patients with idiopathic pulmonary fibrosis are at increased risk of lung cancer. So we're always very careful to screen these patients appropriately to make sure that if we do pick up an early lung cancer, we do it as early as possible so that the treatment is the least invasive that it has to be. The other problem with pulmonary fibrosis is it can cause weight loss, and it can cause a weakening of the muscles just because they're not used as much. So the medical term for this is sarcopenia. And what we know is that if you are a patient with pulmonary fibrosis and you develop muscle weakness because you can't exercise as well and you're not eating as well, then this does reduce your life expectancy quite dramatically.